Our kidneys quietly filter around 50 gallons of blood every single day, but we don't even think to take care of them until something goes terribly wrong, and that happens more than you'd think. Kidneys fail too often, and without any warning, you won't feel any pain or notice any symptoms until it's already too late. But is this damage forever, or is there any way to slow things down, maybe even reverse it? Let's take a closer look at what science actually has to say. Getting to know kidney damage. Before we look into whether kidney damage can be reversed, we need to understand the types. There are mainly two types of kidney failure: acute damage and chronic. The difference between the two types is the duration at which it strikes. If the kidney damage occurs suddenly, it's diagnosed as acute kidney injury. So imagine it as if your kidneys suddenly go on strike, like overnight. But if they slowly get tired over months or even years, kind of like a phone battery that drains a little faster every day, that's chronic kidney disease, also called CKD. But here's the good news: it's not all as scary as it sounds. If your kidneys suddenly crash, they actually have a pretty good chance of bouncing back, but only if you catch it early. However, if it's the slow, sneaky kind, that's a little more complicated. Now, kidney damage can happen for all sorts of reasons. It can be caused by something as simple as the medication you're taking, or other times from old illnesses or an injury that's left its mark. Acute kidney failure usually shows up when your kidneys face something that takes a sudden and major toll on your kidneys. So imagine something triggering, like losing a lot of blood during surgery, which will obviously lower blood flow to your kidneys, putting a sudden and extreme strain on them. It can also be triggered by something as simple as dehydration, something we might not give much thought to, but it's exactly the thing that can force our kidneys to work in extreme conditions, causing some major damage. When this sudden shock to your kidneys happens, your body might swell up from fluid buildup, or important minerals like your sodium and potassium levels might go completely out of balance. Why? Because your kidneys just can't filter all that excess while dealing with the damage. Some people even complain about feeling pain or soreness in their lower back, or notice that their urine looks different than usual. Either there's less of it, or it's discolored. However, on the flip side, chronic kidney disease is often caused by long-term issues like diabetes or high blood pressure. These conditions keep piling extra burden on your kidneys until they're worn down. And here's the tricky part of CKD: it's much harder to spot because its symptoms usually don't show up until the damage is pretty major. And by then, other problems might have joined the party, like anemia or way too much phosphorus in the blood, which comes with its own set of health issues. Hence why spotting CKD early on is so crucial. Here's another crazy tidbit. A lot of people don't even realize their kidneys are in trouble until they're in the hospital for something totally different. That's because kidney problems often show up in routine blood work, not through obvious pain. How so? Well, it's simple. If the levels of waste products like creatinine or blood urea nitrogen are higher than normal, it serves as a massive flashing sign of kidney damage. These waste levels are basically indicators of how well your kidneys are functioning. And if there's an obvious rise in levels, it's a sign your kidneys aren't working as efficiently as they should. Noticing high levels of these waste products, doctors might also do a kidney ultrasound. It's kind of like taking a photo of your kidneys from the outside. If both look smaller than usual, that's a big clue for chronic kidney disease. But here's the kicker: even if they look fine on the screen, it doesn't mean you're in the clear. Doctors still need more tests to solve the mystery. But is this kidney damage reversible? The answer really isn't a simple yes or no. The reversibility, or rather the recovery from kidney failure, depends on many things, from the type of damage to how quickly the diagnosis was made. All of it factors in. Let's break it down a little. Starting with acute kidney injury. Like we talked about earlier, acute kidney injury hits fast. So, one day your kidneys are fine, the next, they're waving a red flag. Now here's the hopeful part. If you catch it early, your kidneys have a really good chance of making a full recovery. In many cases, the damage can be reversed, but of course there's a catch. How well you recover depends on what caused it and how bad the damage is. Treatment is all about tackling the root of the problem. If an infection's the culprit, doctors bring in the right antibiotics. If it's a medication messing things up, they might swap it for a safer one or press pause on it until your kidneys get back on their feet. That's the mild to moderate cases. In the more severe ones, where your kidneys lose their ability to filter waste or extra fluid at all, you might need to undergo dialysis. Think of dialysis like an artificial kidney that does the cleanup job for you. But here's the silver lining. Most people with acute kidney injury get better. In fact, one big study found that over 80% of patients were no longer in kidney failure by the time they left the hospital. Still, it's not something you want to ignore. Sometimes acute kidney injury can leave behind a bit of lasting damage or even lead to chronic kidney disease down the line. That's why the secret weapon here is catching it early. So, keeping an eye out for your kidney function is super important, especially if you already have health issues like heart problems, kidney problems, or you take meds that are tough on your kidneys. And the minor signs are just as important, like unusual pee patterns, discoloration of urine, or sudden onset of vomiting. These can be major signs of kidney damage that you might shrug off, but remember, these signs could be your kidney's way of telling you something's up. And what about chronic kidney disease? Well, the question that comes to everyone's mind is, can the damage caused by chronic kidney disease be reversed? When kidney diseases are diagnosed, they're graded on a scale. So, the severity of the damage and how long the treatment will take are put in 5 stages. This ranges from being at a very mild stage, that is, stage 1, to the most extreme case possible, which is kidney failure at the end stage, level 5. By now, we know that CKD can have no symptoms at all in the early stages, but as it gets worse, you might notice puffiness in your hands or face, constant tiredness, itchy skin, foamy pee, or just feeling off for no obvious reason. That's why there's so much emphasis put on early detection. The earlier the diagnosis is made, the greater the amount of kidney functionality that can be saved. Can CKD be slowed down? Right now, reversing chronic kidney disease is still something science is working on. There's no magic undo button yet. But here's the good news. You can slow it down, sometimes by years, and still live a full, active life without rushing towards dialysis. The key is teamwork, your lifestyle, plus your doctor's plan. So what is the treatment for CKD? Like in acute kidney injury, treatment basically revolves around managing the underlying conditions causing stress to the kidneys. This can include maintaining your blood pressure and, if you have diabetes, keeping a close watch on your sugar levels as well. And to help take some of the load off your kidneys, your doctor might also prescribe AC inhibitors, or ARBs. But what exactly are these? AC angiotensin converting enzyme inhibitors and ARBs angiotensin receptor blockers both work by decreasing the effect of something known as angiotensin II in the body. Angiotensin II is a hormone your body creates to help in maintaining a normal blood pressure. And so, as your blood pressure starts to get too low, your body makes this hormone to push it back up. How exactly does it function? It works by narrowing your blood vessels, specifically in your kidneys. But when there is too much of this hormone, your kidney blood vessels aren't able to relax. What this does is it causes high blood pressure, which leads to kidney damage and other health complications. This is when ACE inhibitors and ARBs come into play. The ACE inhibitors reduce the rate at which your body produces the angiotensin II hormone, while the ARBs block the part of these same receptors that are used to tighten blood vessels. Oh, and another big player when it comes to slowing CKD down is your diet. A diet filled with foods that are high in sodium and potassium will only put more burden on your kidneys. So, to take off some of that extra toll, consuming a balanced diet is crucial. Additionally, when anemia arises, as it often does with CKD, doctors will prescribe a hormone called erythropoietin. It has the gift of increasing red blood cell production in your body, which can help improve energy levels. And for people who do reach stage 5, the stage at which kidney damage is so severe that the kidneys are close to shutting down, or in extreme cases have already stopped working, only 2 main options remain, which are either dialysis or a kidney transplant. Where does that leave us? So back to the original question, is kidney damage reversible? The answer depends entirely on the situation. If we are speaking of acute kidney injury, chances are good that you will fully recover, particularly with early treatment. Most people diagnosed with it, who later on recover well, return to normal kidney function once the problem resolves. If it is more of chronic damage, then it is probably no longer about turning around, and more about management. Kidney tissues do not regenerate after scarring or loss. Therefore, keeping up with treatment is super important to calm the damage done and avoid complications. So the big takeaway? Kidney disease does not need to hinder your lifestyle. This is an illness that can be managed easily by early intervention, some lifestyle changes, and medical help to live a healthy life without leaving you unfulfilled. So, did this change how you think about kidney health? Let us know your thoughts or questions in the comments below. Thanks for watching.